I don't know how great it'll be, and it's certainly not going to be as eloquent as the gentleman that just spoke. But my name's Tom Frenkel. I've been a 30-year resident of Scottsdale and have met what I will refer to as Dr. Q, because I have trouble pronouncing the proper name, Dr. Q, which is, I guess, a bit of a nickname. I met her first as her landlord. Then I became a seller, which I normally don't often become, and finally I became her patient. And the forum today lists me as the official patient representative, and I'm in charge of giving remarks, but I'm going to sway a little bit from that and maybe talk a little about each of them. I met Dr. Q 3-4 years ago when she was looking for a building, and it was a time in Scottsdale which wasn't a wonderful time to be a landlord, and Dr. Q was a very discriminating, very cost-conscious potential tenant, and we never came together, but she reappeared 3 years later. Again, her lease had run out, and she was looking for potentially a space to open her practice and maybe even buy a building. I talked to her, got to know her a little bit. She's initially a bit shy, but actually quite personable once you get to know her. And I am not shy on asking questions, and asked how she happened to become a doctor, how she got to this country, a lot about her. And that probably is my specialty. And what I learned is that she came here basically with nothing, put herself through school, had run a number of business, and put herself in a position to open an acupuncture business as her father had done, and got to know her quite well through just working initially as a potential tenant. In the negotiations, which were similar to the original meeting, I made probably the best statement I ever made to her, which was, I want you to trust me as though I was your brother-in-law. Now, to get Dr. Q to trust someone without numbers, without specifics, was quite an accomplishment, but for whatever reason, she bought into that remark, and we struck a deal, where I would build her out what she wanted, and I understood what she wanted, and give her the opportunity to buy the building. And we proceeded down along the way at the point where she became a tenant. Unfortunately for me, that was very short-lived, because as soon as she saw that she got delivered what she wanted, she went out and bought the building. And for a single practitioner, I have rarely seen someone where she came from a smaller place take on this kind of undertaking with confidence, with sure of herself, and it was probably as unique of an experience as I've seen as a landlord with someone that knew what she wanted, knew she'd be successful, and just was going to do it, and it said a lot for her. Anyway, when I said to her about buying the building, well, Dr. Q, you're only going to use half of it, you're going to have 50% of the building, what are you going to do about it? And here's the quote she said, "Don't you worry about that, I have plans for the rest." Now, as my official role as the patient representative, how I became a patient, of all the people in this room, I would be the most skeptical of any type of medical treatment, Oriental, Asian, Mayo Clinic, whatever. And I was here to go over the punch list of what I had to complete on the building for her, which I still haven't completed, sorry. And I made the mistake of, or not the mistake, I asked the receptionist up front while I was waiting for her, she runs behind often, how do you know Dr. Q? And she said, well, actually I became, and it's Sherry, she's standing there in the doorway. She said, I was a patient, or I came in, I was going to have rotator cuff surgery. I was scheduled. Somebody said as a desperate, I'd had pain for 7 or 8 years. And as a desperate last effort, somebody said, go see Dr. Q. She's helped a lot of people. And she examined me. She said, give me a month, postpone your surgery, and I think I can help you, which she did. She was, this was on a Thursday. I was scheduled for knee surgery on Monday. I'm a bit of a jock, was not looking forward to the rehab and the surgery. And when someone looks at you in the face and says, I was going to have rotator cuff surgery, she changed my life, I'm there for the punch list, didn't really want to go over it with her. And I said, Dr. Q, did you know I'm having surgery Monday? She said, no, I didn't. What for? And I said, I'm just having my knee cleaned out. She goes, would you like to have me look at it? She looked at it, and I didn't know anything about acupuncture, nothing about Oriental medicine. The way she examined my knee, which is a limb that I don't know that I would necessarily think an acupuncturist would know anything about a knee, she probably examined it for 15 minutes, turned it, touched it, moved it, and after 15 minutes, which I couldn't even imagine that she would do it, she says, if you want to postpone your surgery, I can help you. I did. And 3-4 months later, I'm running, I'm playing squash, I'm doing all the things that I like to do. And which, if someone had told me that, I never would have believed it. And as a result of that, which is a much longer story and people would be bored to hear, I was deaf for 23 years in one ear. And after one of the treatments, I came home. My wife and I went to dinner. And I'm in the car and driving, and music is barreling out of the left speaker. And I complained to my wife, did you mess with the balance? And she said, no. Why? And I thought I was imagining it. Go to dinner, come back in, again, blaring out of the left speaker. And I go, Jane, that's my wife, I'm hearing out of my left ear. And it didn't occur to me that she had, through that acupuncture, which she will not explain how it works, although I've heard it had something to do with my gallbladder meridian but I hear out of my left ear. I have almost perfect hearing out of my left ear after 23 years of not even going there. So if I've got to be the infomercial for acupuncture, I could be it. And so
you're lucky she didn't charge you for the ear treatment.
Trust me, I don't think Dr. Q has any problem with charging. That's not one of her weaknesses. Anyway,
she's got a building to
true. A few other things. She's a small little woman, but if you saw the torque that she can put with a thumb and elbow or whatever, I would challenge whatever men combined in here that could put that kind of torque. Anyway, I guess so. Dr. Q, as your patient representative, I will say these would be our wishes from your patients to you. First of all, where's Asia? Asia, where are your parents? Are they in here? Are your parents here? Yes. Okay. Maybe you translated. Thank you to your wonderful parents for producing such a beautiful daughter who cares about people, really loves people, and does a great job of what she does. Okay? And that's her daughter, Asia. Say hi. Much success to you with your business. I have never seen someone that has the ambition you has, that has love of people, that really understands people, and a lot of success from a financial standpoint here, which you will have. But most importantly, you talked about with the rest of your facility maybe doing research or doing other things. I think from your patient base, what we would like to hear is you scurrying through this hallway for the next 10 years, touching the buzzers as you have to go from room to room, happy and healing people, which is really what you were designed to do. So thank you for opening it, and thank you for being our patient, or our doctor.
What